Good morning, everybody. Myself is Professor Dr. Rajendra Deshpande. We are in the Ayurved College, Nigdi, Pradhikaran, Pune 44. With me are the PG students who are doing Ayurvedic Physiology, MD in Ayurvedic Physiology. And today we will continue the discussion regarding the female reproductive system. In the last lecture, we have studied about the female hormones, that is estrogen and progesterone. Few days back we had also talked about the male sex hormones, that is testosterone. So we have already studied the functions of testosterone, functions of estrogen and functions of progesterone. Today we are going to study a particular disease which is very well we can see nowadays in the medical practice, and which is a little bit serious disease because of the consequences as a infertility. The disease name is PCOD. PCOD, Polycystic Ovarian Disease. So today, that is on Wednesday, 27th of June 2018, the title of the lecture will be Ayurvedic Management of PCOD. Ayurvedic Management, Ayurvedic Treatment of PCOD, that is Polycystic Ovarian Disease. But of course, before starting the actual medicine or the Ayurvedic discussion or Ayurvedic approach, first let us understand with the modern medicinal aspect regarding the PCOD. PCOD has the different names, like for example, PCOS. It is the same. PCOD and PCOS are the same conditions. Polycystic Ovarian Syndrome. Syndrome means the group of symptoms or the group of clinical features. This disease is also well known with the scientist's name, that is Stein and Leventhal syndrome. In 1935, Stein and Leventhal syndrome was detected by this scientist, and they found that the clinical features, they come together. For example, amenorrhea or oligomenorrhea, that is the less or stoppage of the menstrual bleeding, plus another clinical feature is hirsutism, Hirsutism. Hirsutism is nothing but the hair on the face, like the male gender, like the mustache and beard. So hirsutism, the growth of hair on the face in the females. Third is obesity. So amenorrhea plus hirsutism plus obesity plus enlarged polycystic ovaries. So when we say PCOS, Polycystic Ovarian Syndrome, it includes amenorrhea plus hirsutism plus obesity plus enlarged polycystic ovaries. So when all these four features are combined together, that is called as a PCOS. Now the next will be the causes or the etiological factors why this particular complaint arises. But before that, I would like to give you the tip. In our medical practice, if any lady comes to you complaining of the secondary or the primary amenorrhea, that means she has stopped her menstrual cycle, and you find that this particular lady is looking little bit fat and she is also having a little bit hair on the face. So primary diagnosis should be confirmed that this lady must have the Polycystic Ovarian Syndrome. So this is by just clinical observation, because the lady is complaining of amenorrhea, she is looking fat and she is having the hair on the face. So that three things are very well supplementary to the diagnosis of the PCOS. Then immediately you can advise for the sonography, and in the sonography you will definitely get the polycystic ovarian features. Now if we consider the causes, what is the basic cause? Rather, it can be said that it is not actually the cause, because cause is quite obscure or the idiopathic, because there is no specific cause has been found to the modern medicine. But what they find, rather they are not causes, they are the findings. When they examine the blood of this lady, they found that this lady of PCOS definitely has excessive male hormone, that is androgen. Male hormone, that is testosterone, that is androgen, is in excess in these ladies of PCOS. This is the first finding by investigation of the blood. But remember, you must ask for examining of free testosterone. There are two types of the testosterone. One is bounded with the protein and another is a free testosterone. You will get the high levels of free testosterone. I am not going into the details of the quantity or the numbers, because that are already printed on any pathological report, but you must understand, you must ask for the examination of or investigation of free testosterone by blood. But before that, there is another hormone which is called as a precursor or the raw material for this testosterone. That hormonal name is little bit tough, so you must write down the name of that hormone in capital letters: DHEAS. DHEAS. This is the precursor of testosterone, and this examination is more important than testosterone. So I advise to the pathologist, give me the report of DHEAS hormone. I will give the full name of that hormone: di, D for di, di, H for hydro, H for hydro, E for AP, EPI, E for AP, A for androsterone, ANDROSTERONE, and S for sulfate. I repeat this name 3 times: DHEAS. This is precursor, raw material for the formation of testosterone. From this hormone, testosterone is developed. So you must ask for DHEAS level, and it is also high in the PCOS cases. DHEAS, dihydroap androsterone sulfate. PG students must remember this name. In your medical practice, it is not necessary, but you must remember the full name. Short form is known to everybody, DHEAS. But dihydroap androsterone sulfate, dihydroap androsterone sulfate, DHEAS, dihydroap androsterone sulfate. This is high. So first we have examined free testosterone, then we have also asked for pathologist level of DHEAS. Next hormone, we will ask for FSH and LH level from the blood, from the lady of PCOS. FSH means follicle stimulating hormone and LH means luteinizing hormone. In physiology, FSH is greater than LH. In physiology, FSH should be always greater than LH. But in PCOS, LH is greater than FSH. In PCOS, LH is greater than FSH. So, I hope you have understood the investigation in the cases of PCOS. We have talked about the blood investigation. As already I have mentioned, we must do the ultrasonography it is usually done in the obese lady, transvaginal USG, transvaginal USG, transvaginal USG. Now I am giving you the details of finding what you will get. You will see in the sonography little developing follicles like cyst, usually under the surface of ovary. That means outer border of the ovary, you will get a small developing follicles or the black spots. These follicles do not invade in the center. Center part will be white in the sonography, and outer border will show black holes. Black color is black holes, and this particular size will be 6 to 10 millimeter. Sizes will be ranging from 6 to 10 millimeter of diameter. So it is looking like a ring around the surface of ovary. A ring around the surface of ovary with a solid white center. Solid white center. In PCOS, this USG finding is called as specific sign. This is a sign, and the name is pearl string sign. PEARL, pearl string sign. Pearl string sign in USG in PCOS, because it looks like a string of black pearls. They are not white pearls, they are black pearls around a white neck. So because of the specific appearance, this sign is called as pearl string sign. Sometimes laparoscopy is also done. Because PCOS is 99% related with infertility. PCOD is the main cause of infertility. In laparoscopy, ovaries look like ping pong balls. Specific word is there. Ping pong balls. P-I-N-G, ping pong balls. So, once again, I will repeat that in PCOS, there will be excessive androgen, high estrogen, and LH will be higher than the FSH. Then there is another important feature that is called as the insulin resistance. In PCOS ladies, there will be insulin resistance. This is specific finding in PCOS, insulin resistance. So what are the risk factor of the PCOS? What will happen? What are the complications that PCOS? Of course, the first is infertility. Next will be diabetes mellitus. Secondary diabetes mellitus is very common in PCOS because of the insulin resistance. Another fear is of endometrial carcinoma. Endometrial CA cancer is possible in this PCOS, and that's why the treatment is must. CA breast is also possible. Breast cancer is very common in PCOS. Why? Because high estrogen level, continuous high estrogen can cause cancer of the breast, cancer of the uterus. Then, because of the obesity, there is a risk of hypertension. PCOS, you will find the hypertension in some ladies. There may be dyslipidemia. Because of the obesity, cholesterol problems will be there. And because of the cholesterol, high cholesterol, atherosclerosis, and lastly heart attack, ischemic heart disease is possible in PCOS. And that is why we must treat PCOS condition either with the help of modern medicine or with the help of Ayurveda. But as there are limitations in the modern medicine, now the people are more and more demanding for the Ayurvedic treatment. So let us start to discuss about Ayurvedic understanding of PCOS. How we can study the PCOS with the angle of Ayurveda. Basically, female reproductive system is compared with Artava Vah Srotas in Ayurveda. Artava Vah Srotas. Srotas means channels. So all the female genital organs, it may be vagina, cervix, uterus, fallopian tubes, ovary, everything is included in Artava Vah Srotas. So Ayurveda says in PCOS there is a problem in Artava Vah Srotas. And mainly the problem is overall in the Artava Srotas as well as throughout the body. When we say there is a problem arises with the normal physiological activity. And whenever there is activity, the word is Vata dosh in Ayurveda. Vata bioenergy is concerned with any activity. It may be the process of oogenesis. You can understand, oogenesis is a process. So there needs the stimulation. Primary follicle converted to secondary, secondary to tertiary. So everything when there is activity, Vata dosh is must. There is a control from pituitary, follicle stimulating hormone. Okay, hormones are pitta nature, but activity is controlled by Vata. Here Vata dosha activity is basically obstructed because of the avarodh. Ayurveda says there is obstruction at different level. Regarding the whole body and regarding the Artava Srotas, Ayurveda says PCOS is a condition of obstruction. PCOS is a condition of obstruction. Insulin resistance. What is insulin resistance? Insulin cannot act. That is obstruction. There is no coming of ovum, obstruction. So everywhere there is obstruction. Why the fat is accumulated? Because there is obstruction. So Ayurveda says obstruction is the main pathology in PCOS. Then we will talk about dosha and dusha. As the person is suffering from obesity, naturally it is going towards the kapha dosha. So main dosha is kapha dosha, that is pathological condition of the kapha dosha, because there is a lot of accumulation of different properties. Which properties are more in the PCOS? Guruta, heaviness. Guruta is nothing but the accumulation according to Ayurveda. Fat is accumulated, so that is Guru according to Ayurveda. Cholesterol is high, then there is a Snigdha. Snigdha is anchas. So Ayurveda says there is a problem in the Guru Guna, Snigdha Guna, and also the Manda Guna, Manda. All activities are sluggish. Fat metabolism is stopped. Oogenesis stopped. So no movement of the Vata, because there is obstruction because of the toxic material Ama and the Kapha dosha. Kapha dosha and Ama are obstructing the normal phenomena of Vata dosha in the Artava Srotas. But in PCOS, the first Srotas affected is Artava, but afterwards there are problems in the Medovah Srotas. So Dusha is also Medovah Srotas regarding the fat metabolism. As this cyst and tumor are made up of or having some relation with the Mausa Dhatu, Med Dhatu. So Mausa versus Lotus is also defective. Mausa and Med Dhatus, muscles and fat, are having intimate relation with the Kapha Dosha. So Kapha Dosha is a dosha, pathological Kapha Dosha. And which are the victims? Which are the pathological tissues? Mausa and the Med. And what is the overall Sroto-dushti? Is a Sanga obstruction. Sroto-dushti, which type? Sanga obstruction. And why these all metabolism process are problematic? Ayurveda believes that all metabolism takes place because of the Agni. So there is a Jatra Agni Mandya. Basic metabolism is defective. The patient do not have the proper metabolic process in the body. With regards to the hormones, with regards to the female oogenesis, with regards to the fat metabolism. So that is called Jatragni in Ayurveda, and also Dhatvagni Mandya. Dhatvagni is a specific concept of Ayurveda. It describes the tissue metabolism. So tissue metabolism is also defective. Shukra Dhatu is not well formed. Ovum is not generated. Unovulatory cycles seen in the PCOS. No oogenesis. That is because of the Agni is defective. There is no stimulant. Now we will talk about the treatment part. We have understood the pathophysiology according to Ayurveda science. Now we will go towards the treatment. I have already told you that any disease, when you want to write the treatment, there are 6 steps you must follow to treat any disease. It may be the cold, or it may be the cancer. It may be the PCOS. First, we will write down again the 6 steps. Number 1, first step, in Ayurvedic language, Sanshepataha Kriyayogo Nidana Parivarjanam. Sanshepataha Kriyayogo Nidana Parivarjana. This is a Sanskrit line, but what does it mean? What is a treatment according to Ayurveda? Ayurveda says treatment means first step is to remove the as far as possible causes. Try to remove the causes, whichever possible. Try to understand. Whichever possible causes, you must remove it. Try to remove possible causes. Number 2, second step, do's and don'ts. You can do this and you cannot do this. To the PCOS lady, you must tell about the diet. You must tell about the lifestyle. You must talk about the behavior. Tell her pathya and apathya. These are the words in Ayurveda. Pathya and apathya is a must. Number 3, third step in the treatment, detoxification of your body. Cleansing by the Ayurvedic Panchakarma procedures. Try to give the cleaning process, but again depends on the indications and contraindications. But you must look for the Shodhana first, detoxification of the body. Fourth step, palliative treatment. That is Shamana Chikitsa. Shamana. You give some internal medicines. You give some external treatments. That is all Shamana Chikitsa according to Ayurveda. Fifth step in treatment. If it is indicated, I advise surgery. SOS. As and when required, you must refer the patient to the surgery. And the last step in the treatment, Rasayana Chikitsa. Rasayana Chikitsa is also called as Apunarbhava Chikitsa. Rasayana and Apunarbhava, these are the Ayurvedic words. The meaning is, after treating the basic things and the patient is cured, patient is okay, then don't stop the treatment. You must give the tonics. Tonics are the rasayan. You must give the tonic. Why? To avoid recurrence. Tonic should be given to avoid recurrence. I repeat the 6 steps of any disease treatment. First, nidana parivarjan, avoid the cause. Number 2, pathya, do's and don'ts. Number 3, shodhana, cleansing, panchakarma. Number 4, shamana. Number 5, shastra karma, surgery. Number 6, apunarbhava, rasayan, tonic. Let us go one by one. PCOS. What are the causes? Causes? No causes. Idiopathic according to modern science. What Ayurveda can talk? Ayurveda can talk in many respects. First, Shukra, Artava, Raja. Try to understand Ayurvedic concept. There are 7 dhatus in the body. Rasa, Rakta, Mamsa, Medha, Asthi, Majja, Shukra. So, we are now trying to find out the Ayurvedic causes for developing this PCOS. Ayurveda always talks in terms of the dosha and dhatu. So we have already talked that there is a pathology in the Kapha dosha and there is a problem with the Guru and Snigdha gun. So it is a part of research, but we are 100% sure. If you ask the detailed case taking of that PCOS lady, you will find that the lady has some or the other causes that I am going to discuss. Ayurveda believes that Raja, that menstruation or the menstrual fluid, is related with the Rasa Dhatu according to Ayurveda. Rasa Dhatu is the first tissue of the body and Upadhatu are Stanya and Raja. That means Ayurveda believes that your first plasma or the body fluids are having some relation with the breast milk as well as some relation with the menstrual fluid or the menstrual blood. And that is why that PCOS lady, we have to search whether there are any reasons of Rasa Vaha Sroto-dushti. This is the Ayurvedic term. Rasa Vaha Sroto-dushti causes. Ayurvedic students and even modern doctors, they must try to study these causes. I will first quote the Sanskrit lines. Guru Shitam Atisnigdam Atimatram Samashnatam. Guru Shitam Atisnigdam Atimatram Samashnatam. Rasavahini Dushyanti Chintyanam Chati Chintanat. Listeners may be non-Ayurvedic, they will get bored with these lines, but this is very interesting. In the PCOS cases, you must find out whether the lady is taking Guru, heavy to digest food. She is not bothering about her digestion. That is wrong according to Ayurveda. Ayurveda says PCOS lady should not take the heavy, high calorie diet. Guru means heavy to digest. Snigdha, fatty, Shita, always cold food. Ayurveda believes if she is always eating the stale food, only salad, only vada pav and only dry foods, that is the problem with the PCOS because it is disturbing your rasa dhatu. Shita, ati snigdha, ati matra, anchas and excessive food and incompatible food, samashnatam. Ayurveda says viruddha ahar. If the PCOS lady is having the habit of eating banana and milk together, which is called as a shikran in Maharashtra state. She is having the habit of taking the fruit, what you can say the milkshake, that is very wrong according to Ayurveda. So all these incompatible foods she should not take, especially with her biotype. If she is a lady of the pitta, she should not take the very spicy food. If she is a lady of Vata predominant prakriti, she should not take the very light diet or the fasting. So incompatibility should be observed. And most important is Chintyanam Chati Chintanat. Stress factor is very important according to Ayurveda. If the lady has a lot of stress regarding her husband, regarding her spouses, or regarding her children, regarding the mother-in-law, family problem, job problems, society problem, then definitely she will land into the PCOS. because her Rasa Dhatu will be defective, and because of the Rasa Dhatu there will be problem for Raja, because they are the Upadhatu or secondary tissues of Rasa. Next, Medo Vah Srotas. Medo Vah Srotas. You should remember the original shloka, which are the causes of Medo Vah Sroto Dushti. Avyayamat Divaswapnat. Avyayamat. If the lady is not doing any short exercise, she is totally only remaining sedentary, her lifestyle is there, then definitely she will land into the PCOS. Divaswapnan, if she is a habit of daytime sleeping, irrespective of the season, that is also bad according to the PCOS. And Medyanam Chati Bhakshanat, if she is consuming the non-vegetarian food, that can be the cause of PCOS. Modern doctors will not accept this. They will say this is unscientific. But if you are saying idiopathic, is it not unscientific? It is also unscientific. Why you are not finding the causes of PCOS? We are searching, we are making the research. So our request is to all the modern doctors, write down these things and try to find out, make a tick mark. Yes, this is fine, this is fine. And then you can confirm the correlation, what Ayurveda is saying for the PCOS and what actual the findings. Because in modern medicine, they say it is idiopathic. Idiopathic is allowed, idiopathic is scientific. But if we are saying these may be the causes, that is unscientific. This is something ironical. It's not very fair on a scientific talk. Why I am giving you the stimulation to you as a PG student, you must discuss these points whenever you come across with the modern pathological gynecologist or obstetrician, you must discuss these points. You are saying idiopathic, you are not finding any reasons. So we are giving you the tips. Try to find out these causes. These may be the causes. I am not saying this is the only causes, but these may be the contributory factor according to their language. Contributory factors. And Ayurveda says, first rule out these contributory factors. Stop them. Remove them. There should be stress management program for PCOS. Then her diabetes will be controlled. Then there will be oogenesis. She should stop the fatty food, high calorie diet. Then PCOS will be cured. Only surgery is not an answer. Do you understand? We have to remove the obstructions. So first we have talked about the removal of the causes. But there we will go a little bit back. These are all causes of Sroto-dushti according to Ayurveda. Sroto-dushti. Why Sroto-dushti takes place? There is before, one step before, reason, Sroto-vaigunya. So you must search for the reason of Sroto-vaigunya. And here, again one point, important point I am discussing, which is maybe debatable. If somebody seriously heard about it, there may be some challenges from the modern doctors. Why you are saying like that? But this is very important as a part of research. Ayurveda says your female genital system, anatomical, functional, it becomes problematic if it is a defective some things that you are doing. For example, OC pills, hormonal pills, that can damage if it is not recommended by the doctor. And still if it is recommended by the doctor, if you are taking continuously without making any seriousness about it. Oh no, it is normal. We should take it. Nowadays, you can see that there is a early menarche. The ladies, we have the impact of the foreign culture, free sex, interrelationships, and the small ladies. This is a part of research. They are taking from their school level, 8, 9, 10 standard girls. They are sometimes found that they are doing this type of the things, taking the pills and enjoying the sex. So we must go for that. And now PCOS, the cases are increasing. So you must take out the history if that particular girl is consuming OC pills for a longer time. This can be reason of defective your whole system. In Ayurveda it is called as a Sroto-vaigunya. Another reason, This is again debatable point. Ayurveda has mentioned specific lifestyle during the 4 days of menses. Specific lifestyle during the 4 days of menses, Ayurveda has given scientifically. This is most of the times challenging part from the modern doctors. Many people come and they challenge what you are talking about. It is ridiculous. No, it is not ridiculous. Ayurveda says during the 4 days there should be enough rest. There should be enough rest to that particular girl or to the lady. When the menses are going on, there should be adequate rest. Okay, sanitary pads are very good. Sanitary pads are very good for the hygienic purpose. But that doesn't mean that use the sanitary pad and do whatever you want to do. Because nowadays, unfortunately, on the media, on the advertisement, they are propagating what they are propagating according to their science. They say 4 days are not different, they are normal. Okay, I accept that is normal. But using sanitary pads and jumping and doing the sports, it is not scientific according to Ayurveda. And why not scientific? I give you the very simple example. If I get any wound on my plantar aspect of the leg, is it okay that I am doing the heavy friction on that with that particular feet? If I continuously walk, whether that my wound will heal? No, wound will not be healed. If I have the wound at my, say for example, right hand, I usually do the bandage and keep that hand separate, and some few days till the wound heals, I do all my work with the left hand. Similarly, menses are nothing but bleeding through the wounds. Try to understand. Bleeding through the wounds, because if you go for menstrual cycle physiology, there is a phase of regression. The last phase is called as a regression. All of a sudden, estrogen and progesterone is taken out, and because of that, tensed vessels which are coiled, tensed vessels, they are coiled and they break down. So vessels are breaking down. There is ischemia to the endometrium, and that's why the blood supply is cut down of the endometrium, and that part is died. That is called as the necrosed part of endometrium. So what is that? There are the wounds in the uterus. Of course they are physiological, I accept, they are not pathological, but still they are like the wounds. So if the lady is having some wounds in her body, whether it is expected to jump and do the sports, no, not at all. So that is called as, according to Ayurvedic science, is maybe the cause of Sroto-sanga. So in each case of PCOS, you must take the history of the menstrual cycle lifestyle, what she is doing in these 4 days. Again I repeat, I am not against of sanitary pads. Sanitary pads are 100% good for the hygienic purpose. You can use the sanitary pad, you can do your regular job, go slow and steady in your life. Everything is absolutely normal. You go to the office, do your computer work, sit down in one position, move here and there for your communication, that is okay. What is my objection? Objection is for jumping and doing the sports in these particular 4 days. And that research should be done by even modern doctors regarding the cases of PCOS. So, in Pathya and Apathya, again you have to advise the same thing. First you advise about their menstrual routine, what should be the lifestyle. Second thing, you must advise about the food habits. She should not do the excessive, consume the high calorie diet or the fatty substances or non-vegetarian food which are heavy to digest. Third thing, regarding the yoga, you must advise them some yoga philosophy. She must follow some simple postures to improve the Agni. For example, Pavana Muktasana is the best for uterine and female genital organs. Pavana Muktasana. But I am not saying this should be done under the supervision of yoga teacher and also at specific guidelines. It should not be done by of your own. Simple precautions. Yoga should not be done during the 4 days of menstrual cycle. Yoga should not be done after taking the food. This and that. Second thing, regarding the meditation, she should learn a habit of doing pranayama, controlled breathing exercise. It is must, because that can make a neurohormonal rhythm. This word is very important, neurohormonal rhythm. So pranayam, dhyana, meditation and anti-stress program should be advised to this particular lady. Then shodhana. Ayurveda believes we require all types of the panchakarma, especially vamana, as this is the main problem of kapha pathology. Vamana is the best for kapha chedana and removing the obstructions. So therapeutic vomiting, vamana panchakarma should be done. Second, virechana. Time. You should go to the panchakarma specialist or Ayurvedic doctor and you should take the treatment on with the guidance of particular his intelligence and experience. So virechana is good for the PCOS because it can do the vatanulomana, normal movements in the female genital tract, and also the normal conduction of neurohumoral conduction. Brain to pituitary gland to ovary. These connections will be proper even after doing the vatanulomana. So remember, virechana is not acting only on the pakvashaya, because this is a misconcept. Vaman is only for chest, virechana is only for the large intestine, basti is only for large intestine. This is wrong concept. Ayurveda says effects of panchakarma are seen throughout the body, all over the body, every organ of the body. So virechana is useful for vatanulomana, especially in the koshta and artava srotas. So different medicines can be given. In Maharashtra state, you can use the Ashwakanchuki or the Ichabedi. These are the tablets. Ashwakanchuki tablet or Ichabedi tablet, or Erand Bhrishta Haritaki. The name of the tablet. Erand Bhrishta Haritaki. Eranda is a resinous oil, castor oil. Eranda Bhrishta Haritaki tablet. 2 tablets in the morning. In South India, they use the Kalyana Gulam. Kalyana, K-A-L-Y-A-N-A, Kalyana Gulam. 25 grams in the morning. Or they use the Sindhuvar Erandam. S-I-N-D-U-V-A-R-A. Sindhuvar Erandam. That is castor oil, 25 ml at 8 a.m. in the morning. After Vamana and Virechana, you can advise Lekhana Basti, Lekhana, to reduce the size of the cyst. Whenever there is a avarana, obstruction, cyst, tumor, always recommend Lekhana Basti, scraping medicated enema. First is Eranda Muladi Basti. Eranda Muladi Basti. What are the contents? First, take in the pot honey 200 ml and Saindhav 5 gram. In mortal and pestle, Khalbatta, in mortal and pestle, you take the honey 200 ml and Saindhav 15 gram. Then little bit add Murchit Tail or the oil, sesame oil, 200 ml. Then add Yavanyadi Kalk. Yavanyadi Kalk, that is a paste of specific plants, 30 gram. Yavanyadi Kalk, 30 grams. Then add Triphala decoction. Triphala decoction, 300 ml, and Dhanyamlak, 200 ml. Dhanyamlak, 200 ml. Make it warm and then add a little bit Yavakshar, 10 gram. Yavakshar, 10 gram. So this is one of the prescription of Lekhana Basti. Another prescription for the same Lekhana Basti, again honey 150 ml, Saindhav 10 grams, Triphala Kashaya is same, but in spite of Yavanyadi Kalka, you can use the Hingu Vachadi Kalka. Hingu Vachadi Kalka 30 gram. And then, in addition, you can add, in spite of Dhanyamla, you can use the Kulatha Kashaya, Kulatha horse gram decoction, 150 ml. And there will be also Yavaka Kshar. So specifically I have given the recipe or the formulation for Lekhana Basti. So this, of course, all these medicines I am recommending is not for self-medication, but for the education of the medical students. These lectures are basically meant not for the common man, but basically for the medical students. So nobody is expected to take the self-medication by just hearing these lectures. Now, in addition to the Panchakarma, we can have the external treatments like Udavartana. Udavartana, dry powder massage to reduce the Kapha and Meda scrapping. Pathological Kapha, pathological Meda, that is fat, will be reduced. We can use the Rasnadi Churna or Triphala Churna for Udavartana. Rasna and Triphala, they are astringent, they improve the muscle tone. Then you can advise Avagaha Sveda. Avagaha Sveda, that is tub bath. This is very useful for the female genital organs, especially large intestine, uterus, fallopian tubes, etc., because there will be Sroto-sanga. Hot fomentation is always useful to dilate, to remove the obstruction from large intestine as well as the female genital tract. So Avagaha, Sveda, tub bath is very useful, but taking care of course, hypertension. If the lady, PCOS lady is having the hypertension, you must be very, very careful while giving any fomentation. Any fomentation. Because there is a very great risk of bleeding in the brain. Remember my words. Or if not, if there is a shoot of the blood pressure, the patient can fall down because of the giddiness that I have experienced. So mind well, in the hypertensive patient, fomentation should be very, very, very careful. Before and after, always check the pulse and BP. Next, we will talk about Shamana Chikitsa, internal medicines. All the internal medicines are Kaphagna, Medogna, anti-Kapha, anti-fat. So they will improve the functioning of Artavava Srotas. They will reduce the size of cyst, polycystic ovary. So they will help to dissolve that cyst. The sizes will be reduced. So what we can do? I will first give the list of the tablets. Of course, all these tablets are not used at a time. They are used according to the stages of the disease. So first you can begin with Rasapachak Vati, because Raja is a Upadhatu of Rasadhatu. So to improve the metabolic process, you must give the Rasapachak Vati. All the tablets are usually given 250 milligram each tablet, 2 tablets 3 times in a day. The best Anupana will be, in all these PCOS case, warm water. Lekhana, warm water is very nice as a Anupan or carrier. Second Lekhana Dravyas are Triphala Guggulu. This tablet is very well proved to reduce the weight. My friend Dr. Prakash Paranspe has already published an article, research paper 20 years back in the Lancet journal, very well-known journal, Lancet, Modern Medicine journal. And he said Triphala Guggul, 250 milligram tablet. 3 tablets, 4 times in a day. 3 tablet, 8, 12, 4, 8. Remember the timing, 8 a.m., 12 noon, 4 p.m., 8 p.m. Give every time 3 tablets of Triphala Guggulu for 1 month, 2 months, and you will find that the weight is reduced. But whenever I recommend any tablet, don't forget the basic principle of Ayurveda. Ayurveda says always there should be the triangle of medicine. There should be triangle of medicine. What is that triangle? Ahar, Vihar, Aushadhi. Ahar, Vihar, Aushadhi. Ahar, Vihar, Aushadhi. So not only tablet will work. Diet control, diet prescription, exercise prescription, and then medicine prescription. Ayurveda always believes. So if I say Triphala Guggulu is good for obesity, it doesn't mean that is only tablet. Again, what is there? Ahar, Vihar, Aushadhi, diet prescription, exercise prescription, and tablet. But Triphala Guggulu is best. For reducing any granthi in Ayurveda. Granthi, Arbuda, these are the words for tumor, cyst, gland. Which is the best medicine? Kanchanar Guggulu. Kanchanar Guggulu is best to reduce any gland in the body. So, PCOS, Kanchanar Guggulu, 3 tablets 3 times in a day. Then, there is also Chandra Prabha tablet. Chandra Prabha is basic, is a Tamra Bhasma and Shila Jatu. These are Lekhana Dravyas, scrapping material, removing the Sroto-rodha for Apana Vayu. Chandra Prabha is basically acting on the lower part of your body. Don't forget it. It is acting on genitourinary system. Chandra Prabha is good for genitourinary system. Chandra Prabha is best for controlling diabetes. Because according to Ayurveda, Shila Jatu is the best rasayana for the diabetic patient, for the obese patient, and for PCOS patient. So Chandra Prabha, or another same tablet is Shila Jitvadi Vati. Shila Jitvadi Vati. Shila Jatu. This is the content. Shila Jatu is a black bitumen. Shila Jitvadi Vati. 2 tablets 3 times in a day. Then there is a Rajapravartini Vati, generic medicine. Rajapravartini Vati is best to promote oogenesis, to make the cycles ovulatory for the formation of ovum. Rajapravartini Vati is must. Rajapravartini Vati contains Lata Karanja. Don't forget, this is a very important plant, Lata Karanja. Then, in addition to these tablets, there are some liquids which we can prescribe as an anupan or independently. Which are the liquids? First, for any tumor, any gland, Varunadi Kwath. For any tumor, any calculus, any gland. For PCOS, Varunadi Kwath. Kwath means decoction. 4 teaspoons of medicine plus 4 teaspoons of water with these tablets. Next is a Sapta Sara Kadha. In South India, Sapta Sara Kadha is given for Apana Anulomana. Sapta Sara Kadha, Apana Anulomana. Then there may be Sukumara Kashaya. In South India, they use Sukumara Kashaya. Sukumara Kashaya, Kashaya is a decoction, act on the Pakvashaya, large intestine, and corrects again Apana Vaigunya. Ayurveda believes that Apana is a type of the Vata Dosha, Vata bioenergy, which controlling the movements with relation to our lower part of our abdomen. So Apana Vata is a specific name of the Vata bioenergy. So Asana Kadha, next is a Asana. Asana Kadha is best for insulin resistance. Asana Kadha is the number 1 for controlling diabetes, your blood sugar. Asana Kadha. Then There is Ayasakruti. Ayasakruti. All these decoctions are available from the South Indian companies, like for example Aryavaidya Nilaya, AVN, etc. Ayasakruti is indicated in diabetes mellitus, obesity and anemia. Ayasakruti is a liquid. Ayaskruti, 4 teaspoons of medicine and 4 teaspoons of the water, warm water. So these are something regarding the liquids. Then medicated ghee. There is always a question from the common man. On one side you are talking the PCOS ladies are the fat ladies, obese, and why you are recommending the fat ghee. But remember, Ayurveda has, next is a Sukumara Dhrita. Sukumara Dhrita. Again I repeat, the ladies has cured with the problem of PCOS, but she has still remained with irregularity in the menses. If irregularity remain, then use the Sukumara Dhrita. If anemia has remained, use the Dadi Madhi Dhrita. Irregularity of the menses, Sukumara Dhrita. Third is a Phalagrita. Phalagrita, again the same. Cysts are gone. Infertility has remained. Then use the Phalagrita to give the tonic to the uterus. So I hope that we have seen also the Shamana Chikitsa in proper. Next point was the surgery. If at all, if it is recommended and if it is indicated very seriously, if it is a cancerous complication, then you must refer these PCOS case to the surgeon for any particular surgery. And last, we have seen the point of Rasayana Chikitsa that we have already discussed. All these Chandraprabha tablet, then the Asanadi Kada and all these Ghrutas are nothing but the Rasayana tonic for this PCOS case. So my dear friends, I hope that in this lecture of nearly 1 hour, we have talked a lot about main disease regarding the infertility, that is polycystic ovarian disease. And there we have seen the basic problem. The cause is idiopathic, but the symptoms are obesity, hirsutism, and also the amenorrhea, and the cysts are seen in the sonography. So which investigations we should do? And then we started to talk about the Ayurvedic management or Ayurvedic philosophy regarding PCOS. The main problem is Sroto-dushti, Sroto-sanga, Kapha dosha and the Medha dhatu. Kapha dosha and Artava Srotas. These are the main things, and Rasa or the Raja is a Upadhatu of the Rasa dhatu. So we must take care of the Rasa dhatu, Maus dhatu, Medha dhatu, and that's why we have seen the causes of all these Sroto-dushtis. And I hope then we talked about the 6 steps of the management. First, Nidana Parivarjan, rule out the causes. Second was the do's and don'ts regarding Pathya and Apathya. Third was the Shodhana Chikitsa, that is Vamana Virechana and Lekhana Basti. Then fourth one was the Shamana Chikitsa with tablets and decoctions. Fifth one was the surgery, and sixth was the Rasayana or the tonics. So thank you very much for your patience hearing, and I wish you all the best. Take care.